Welcome to this video presentation of MB Direct Medicine. I'm Dr. Thomas Kay. I'll be leading you through the video. Hopefully this will answer questions you have about direct primary care. And after this, we can have another conversation discussing any other questions and going over pricing. But let's get started. So 3 common things you see in practice of medicine that I hear a lot of complaints about, and why I went into direct primary care is 1, access. People call the first time and the next available appointment's 3 months out, or they're a current established patient and they call with a sick complaint and the next available appointment's 2 weeks. I see this a lot in the ER. Just doesn't have the access. And when you call, you get lost in the voicemail maze, or a person that's at the front desk or staff, and usually never the doctor. Big problem because you just don't have access to the people you need to talk to. The other one is time. You go wait 60 minutes or longer in the office to be seen for 5 minutes, FaceTime. Again, doesn't give you the time and is very time inefficient with you. And those two being said, lack the tying to the last thing that's connection. They're not connected to the doctor. Their insurance plan changes. They have another doctor, different person, mid-level, all these different things going on. It creates a problem. So with that, I found that direct primary care, this business model is what is very appealing. This allows just direct contact. You can text me, email me, office, call me on my cell phone. Again, you have access to me, not the staff, me. There is no office staff. The other thing about the time is you're not going to wait 60 minutes, like I said. You're going to wait minimal and see me as long as we need to, face-to-face or telephone, text, email. Again, have the time to answer your questions. It's time efficient for you and me. You're not wasting your time trying to call and get an appointment and then get all the logistics of all of that entails. You get directly to me. We're not tied down to geography. You don't have to come in the office. Some things we can handle the phone or email. Again, we can be a lot more flexible. And it gives us opportunities to be creative and then more useful with our time. Again, all those 2 things are then established connections. So you're now known. You'll be cared for. I'll be your health advocate. So if there are things I can't do, I help get you the right direction, right place that can be care for you. Hopefully keep you out of the ER and urgent care. And then hopefully, again, the goal is to get you healthy so you can do what you feel called to, work or play. The feature of this, pretty standard features of the clinical model is your standard primary care, acute illnesses, chronic prevention. So acute care would be, bladder infection, stomach bug, flu. Chronic would be if you have a thyroid, reflux, diabetes, hypertension. Those are addressed and really personalized. Prevention, pretty standard. Cancer prevention, cardiac disease prevention, those kind of things you may think of for conventional medicine. Again, we're going to treat the whole person. So your body, soul, spirit, all those are on the table. All those need to be addressed, and you will be taken care of as a whole person. This is a great example of one of the first things we'll work on is vitamin D, getting your vitamin D level correct. Look at all the things that plays into. There's so many things that actually we had to leave things off when they asked me what to put on this page. We had to leave some things off because there just wasn't room. But look at so many vital things that vitamin D plays into. This good slide tells you, talked a lot, last few slides of what direct primary care is. Well, this is what it's not. It's not health insurance. You still need health insurance or medical share program or whatever ways you want to finance your healthcare. This practice doesn't cover your supplies, labs, prescription supplements. Don't admit to the hospital. There's still a place for the ER and urgent care. If you're having chest pain, you need to call me from the ER, not you should come to my office or something like that with chest pain. There's still a place. This does not meet the ACA requirements. So you still need to do things that qualify you so you don't get fined or taxed for that. Things to take into consideration when I'm out of town or out of country, like with any of us, we will not be reachable sometimes, but that will be known ahead of time and have a plan in place for that. I'm still doing full-time ER work, so that means I'll be doing 13, 14, 15 shifts a month. So when you call me, I may be in the ER, but we can work around that and be creative with that. Also, after hours weekends want to be considerate, just like you would want. We need healthy boundaries. So if it's after hours or on the weekends, it needs to be emergency, urgency. If not, maybe an email or text would be sufficient. Also, I ask for people to have a 12-month commitment. Just don't want to do this for a month or 2. It takes a lot of time and resources to onboard you. So we want to make sure that we have a commitment at least a year. And I hope, of course, that this goes on longer than that, because my desire is to have a long-term relationship with you, taking care of your primary care needs. So I hope this answers a lot of questions you had. Again, we focus on access, time, connection. I think that's where the heart of the practice is, and my enjoyment of taking care of you and patients. I hope this answers the questions you have, and I look forward to our next conversation where we can answer any of the questions you may have now, and then also go over pricing and hopefully set up our initial appointment so we can start co-creating health together. Again, thank you so much for your time, and I look forward to talking to you next.